Hello, my name is Vicki, and this is a quick review of the NISIS negative pressure device from Cork Medical. When you have your device and you've turned on the screen, what you will see at the top is a battery indicator along with the percentage of battery that you have left. You have a nice long battery life in this device between 24 and 48 hours. And at the top is also your date and time. In the center is your target pressure. This would be your prescription. You have a range from between -40 to -200, and your devices will come to you from manufacturing set at -125 in a continuous mode. Underneath the 125 is your total runtime, and this is the hours and minutes that this device has been running on your patient. So if you think that you're missing time, it will be indicated in fewer hours and minutes than what you would expect based on your dressing changes. The below that is your mode, and that is states continuous because we also have a variable intermittent option in this unit. Down below are the buttons that you use to navigate your screen. You have a power button. When you turn this unit on, it automatically pulls to your prescribed pressure. So if you have a good seal, you don't have to do anything else. It will start up. You'll hear and feel it hum a little bit, and then it'll quiet down as it matches that target pressure. You also use the power button to turn it off, and it will count back 3, 2, 1, and turn off. In the center is your menu select button. That's the dark blue button. That allows you to go to the menu, and then you use the directional arrows that are around your up, down, left, and right to highlight what you'd like to choose, and then back to that center button to select what you've highlighted. And then you use your exit button to go back to your previous screen. So it's very basic navigation. The screen is where you read, look for information, and the buttons are how you navigate into the device itself and change your settings. We do have the ability to lock patients out on the home screen. There is a padlock. It will come to you unlocked or open. And if you press your up and down arrows at the same time, that lock will close as indicated in the center of the picture there. That deactivates the buttons down below. If you would like to unlock it, again, hold the up and down arrow simultaneously and that padlock will open. We also have a sleep feature that dims the LED light that sits behind the screen. If you use your left and right arrows, the small white S will show up in the bottom right-hand corner of your screen, and then shortly thereafter, the screen will go dark. If you press any button, it will light up again if you would like to see what's going on the screen, and you can do the same thing, press the left and right arrows to take it out of sleep mode. If you get any alarms while you're in lock or sleep mode, the alarms will bypass both of those modes and they will still show and give you all the troubleshooting instructions. From your home screen, if you press the menu select button in the middle down below, you will go to the menu that's shown on the left. You have 4 choices in your basic menu. You have therapy mode, alarm, troubleshoot, and settings. Therapy mode is highlighted. It's always highlighted when you go to the menu from your home screen because that's typically where clinicians go. If you select therapy mode because it's highlighted, then you'll be looking at the screen in the center, and that's probably the most important screen for clinicians. This is where you can change your settings and you can see what the device is currently running at. You can see based on what it's showing there that it is set in continuous because continuous is highlighted, and the target MMHG or your prescription, what you have it set at, is at 125. There's a gray arrow on either side of the 125. When it's highlighted, that would indicate that you can use your left and right arrows to change your settings. It goes in increments of 5 millimeters of mercury. So if you wanted to change it to 130, you'd press your right arrow once, that would change to 130. And then when you go to select or exit, the screen will change and ask you if you would like to accept your changes. If you do, back down below, select the yes, and then your new setting will run. You can also in the screen see what the device is currently running at, and on this it shows that it's currently running at 20. So if you put a new dressing on your patient and you turn it on and it's pulling the air out and it's not quieting down, you might want to know how significant is that leak. You can press your center button twice, that menu select button twice, and look and see, is current matching my target? If it's 20, you have a significant leak. As you're running your fingers around the drape to try and figure out where you need to patch, if you want a visual aid, you can look at this number because it is a live active number and it will pop up and get closer to your target pressure when you're at the area that needs additional drape or needs to be patched. Also, if you would like to put it into an intermittent, this is where you would do that. You would arrow from continuous over to intermittent, highlight that and select it. And then the values you would need for your intermittent sequence are depicted there. So you would need your up pressure and the amount of time at that pressure, and then your low pressure and the amount of time at that pressure. Once you accept those changes, the device will run that sequence for you for your patients until you tell it to do something else. You have 4 alarms in this device. You have a leak alarm, a blockage alarm, canister full, and your battery alarm. For your battery alarm, you have 2, one when it's at 20% left and one when it is at 11% left. And again, you have a nice long battery life. Keep it plugged in if your patient is sitting in their chair all day or in bed. But the critical battery, you will need to get it plugged in to the wall with the charging cord into the device. For your leak and blockage alarm, you can mute the alarm. The screen will change and ask you if you would like to mute the sound. Yes is highlighted. Back down to that center button to select yes, and then your troubleshooting instructions come up behind that, which is shown in the center. Your troubleshooting instructions will start with number 1, and then you can see at the end of the sentence there's a down arrow telling the user to use your down arrow to go to number 2, number 3, number 4, number 5. This is the same for your blockage alarm and your blockage instructions. For your canister full, it gives you full instructions on how to change the canister, and this is when you would need to take it out of the carry case to do so. If you mute your alarm, it's a temporary pause for about 3 minutes, and so if you get pulled away to another patient's room, it will alarm again. In the alarm, the red triangle, this is where you'll find your log display or history of the alarms that have sounded on your device, along with the date and time. So if you need a history of what's been going on, you'll find that in that red triangle alarm area. And then in settings, this is where if you need to change it from English to Spanish or change your date and time, you can do so there. You can also do a runtime reset on the home screen if you would like to set that back to 0 at any time. The canisters are easy on, easy off. So you'll need a device, a canister, and your kit to start your negative pressure. The canister has a pivot hinge on the right. You can see that in the picture on the right, and then it just snaps in with that clip on the left. The canister change frequency is when the canister is full or once a week. Your kits have everything you need in them to do a basic dressing change. So you have your foam, your port pad, and your drape. In your small kit, you have one of every item. They all also have a disposable measuring tool in them. In the medium and large kit, you have 2 sheets of drape, and the large kit has a larger piece of foam than the one that you're looking at. If you need instructions on how to do a negative pressure dressing change, step-by-step instructions are found on the outside of the kit, so you can read the step-by-step instructions there if you need a reminder. Also, the size of the hole that you need to have underneath the port pad is also listed on the outside of the kit. It is the size of a quarter, and it is the size of the opening that is underneath the port pad. So you would need to make the opening in your drape the size of a quarter before you put your port pad on the drape. We have accessories, a cleanse therapy, bridge, and we have a Y connector and an extension tubing if you do need an accessory to go along with your basic kit. Concludes the short 10-minute training video for the negative pressure wound therapy device. We do have a 30-minute video that goes into more detail on some of the features that can be found in the device, but this will get you started. Thank you for watching.